Welcome to the Operatory, the podcast about burying the dinosaurs in dentistry, moving past outdated technology procedures to find a better way. With me today is David Pryor. Hello, patient friend.
Hey, Brian, how's it going?
Good. Providing the patient perspective, which is always necessary. And again, as promised last week, part 2 with the amazing Dr. Eli. Thanks for being here, sir.
Why, thank you for having me.
Well, when we first met and you were telling me about today's topic, you just blew my mind. So I am excited to bring this to our audience today. And we seeded it last week. The fact that dentists oftentimes can cause TMD issues and facial pain. And so with that, I just kind of want to open the floor so you can sort of discuss kind of what I meant, sort of parodying, probably hacking apart your words about how that can actually come to pass.
Well, this is a topic near and dear to my heart. Over my last 25 plus years doing this, what I've been most struck by is I can't figure out who's going to be a patient and who's not going to be a patient. And so it really started to drive me in a direction of saying, what is it that is happening to this population when it comes to jaw joint and muscle facial pain? And so
one of the classic sort of conundrums in dentistry, right?
It is, absolutely. So, you grind your teeth and that's why you have a jaw problem. Well, that's been debunked. Your bite is off and that's why you have a TMJ problem. Well, to a large degree, as we were saying earlier, then why don't everybody with orthodontics who have a bad bite for 2 years straight get a TMJ problem? Mm-hmm. So as I was looking at it, I was realizing that one of the things that we learned in dental school is where the temporomandibular joint was located and the muscles that attach to it. So we learned the anatomy, but we did not learn the physiology. And so when I came to the physiology side of it, I said, what class did I have that told me how wide I could safely open somebody's mouth? And then what class did I have that told me how long could I keep that person's mouth that wide open? And then the third class was not present, which was if the person calls and says, my jaw is killing me from yesterday's procedure, what exactly am I supposed to tell them to do? So hence I was set. The table was set for the rest of my career, which was getting that fixed. So I started looking back in my training and I started looking at how when I went to the dentist to get treated, what things were they concerned about, worried about, and how they did what they did. And what I realized is there is a gaping hole in the education.
An open wide hole.
Yes, exactly.
The bite block in it.
Yes.
That's right.
So nothing like a dental visit to complete a person's life.
Yes.
But yeah, so one of the things that I often say is if you put 100 dentists in a room and you said, how many people in the room, raise your hand if you think it would be a good idea to have a person open as wide as they can, put a big, hard piece of rubber on one side and have them bite down on it for 45 minutes. I don't think anybody would think that's a good idea. Mm-hmm. So when I started looking at how dentistry was done, it's done in a manner to speed the patient through the process. And all of the things that we were taught to use were actually complementary to the dentist getting the work done quickly, not necessarily to the patient having it done comfortably. So when you look at things like anesthesia, local anesthesia placed in the lower arch, as you know. You don't know, but you felt.
He doesn't feel it because he comes to see me.
Okay.
But yeah.
No.
Otherwise,
So I didn't learn to tell my postgraduate training that local anesthetic is toxic to muscle tissue. So when you inject through the medial pterygoid muscle and then you have the person stay open, hold their mouth open for 45 minutes, it's like punching them in the arm and then having them go work out. So it is actually very common for a person to have post-operative discomfort, so much so that the providing dentist rarely hears from the patient that they have a sore experience, because everybody in the room kind of has come to the agreement that that's the normal. So we don't as a practicing provider, we don't promote the patient call and say, hey, I'm having some pain after these procedures. And what drove me to push this forward was I was seeing patients, but they were being referred by their primary care physician post a dental procedure. So when I would ask them, well, did you tell your dentist? They would say, no, why would I tell them? And so it was months after the procedure had been done.
well, and if they did, they probably just called, talked to the front desk, and they're like, "Yeah, that's normal."
Correct. Yeah.
Yeah. So the dentist doesn't even know what's going on.
Well, they're unaware. If they were aware, or if they knew that there was something that was an alternative. And most of the people who have experienced this kind of an event, as you and I talked about before, I refer to them as kind of a special needs group. They know who they are. These are people who say, every time I have this done, this happens. And so, but, it's like, we just need to get it done. So dentistry is a very time in motion kind of field. You schedule a block of time. This is what you're going to do in this block of time, come hell or high water. And, that's unfortunately promotes that thing. And there's no information given to the dental student on that this is even happening. So wide opening for surgical procedures. You can hyperextend the jaw very easily. But remember that a person who's intubated for a surgical procedure is then given succinylcholine, and there's all kinds of other drugs that are pumped into their system that relaxes the muscles that dentistry doesn't do.
That's a component in Mountain Dew, I believe, too.
Yeah.
That he drinks, right?
Red Bull.
Red Bull. Sorry,
Red
it's
Bull.
Red Bull today.
It's Red Bull today.
Yeah. Well, it's really, it was eye opening to me that how having a patient want to bite on a bite block. I don't think about it like a unilateral bite block and opening as far as we can, so I can get back to number 18. That we could cause that sort of acute pain in the jaw joint, and then you had also mentioned the consequences if it's not adequately treated. Could you kind of discuss that with our audience?
Sure. So what you're describing is a muscle or jaw joint sprain strain injury, and it's no different than any other sprain. The only part of the story that's different is long ago orthopedic surgeons were invented for sprained ankles, and an ACE bandage was created by orthopedic surgeons because if you sprained your ankle and all it took was wrapping it up and icing it for a week, they didn't need to see you. So what we have tried to do is we've put together a program to help the general dentist promote the idea that if a person has pain following a procedure, that they will bring it up to the office. The office will respond in a timely fashion by putting a jaw splint, so to speak, not a big thing where you have to take an impression and you send it away to the lab, because the clock is ticking. So there is some pretty...
That's kind of what I wanted to get to
Right.
the audience too. The clock is ticking because
Right.
if you don't take care of it in, I believe you said 40 days.
So it's
Right?
4 weeks, yeah.
4 weeks,
Within
okay.
30 days, we have data that says that a symptom that is present from date of onset to 30 days has a greater than 50% chance of being present at 5 years.
So what I mean, that's a key point, that if somebody comes in for a routine dental procedure and then as a consequence of that has a jaw strain or strain and that lasts for over 4 weeks, that is a chronic condition then at that point.
You have put them into a higher risk
Yeah.
group, and fundamentally, as I mentioned before, dentists look out for their patients. The idea is to keep a person healthy. Dentistry is healthy treatment. So the idea that they wouldn't do anything or have anything to do to keep that person healthy really is against what is in the heart of most dentists.
Yeah, and especially if you think that this is a routine consequence, that which it can be, of care, and that's what's, I think, the sort of the point that I thought was so important to let our audience know in part 2 of our series is that while doing routine dental care, even if you do everything right, the patient can have an acute reaction to it, and that should be managed, not ignored. And I guess that will lead us to our part 3 of this series, which is how do we actually actively manage the acute jaw strain that is a consequence oftentimes of our routine dental care. Does that ring true for you?
Absolutely. I look forward to part 3.
All right, let's do it. Dave's yawning over there and dislocating his jaw as we speak. Did you get some jaw strain over there, Dave?
Yeah, a little bit.
Okay. Well, thank you very much. For more information about TMD facial pain and how to treat these patients with products like the Quick Splint, go to quicksplint.com. I also want to remind you to rate and review us wherever you're listening to this podcast. And if you have suggestions or comments, please visit theoperatory.com and drop us a line. Again, I'm Dr. Bryan Laskin, host of The Operatory. Thanks for listening. I look forward to speaking with you next week.